And we're now joined by Dr. Jeff Goldman. Thanks for joining us today. Tell us a little bit about what a gastroenterologist does.
Sure. A gastroenterologist is a medical specialist, and we specialize in caring for patients who have problems with their digestive tract. So this is a diagram of the entire digestive system, and it starts with your esophagus, your food passage. It goes down into the stomach, and then it goes into the 20+ feet of your small intestine where digestion takes place, and then it enters the colon, which is the lower 5 or 6 feet. The digestive tract also includes the liver, which is a very important organ, and then the gallbladder, which empties into what's called the bile duct, which empties into the small intestine, and the pancreas, which sits behind the stomach, and that also empties its digestive juices into the intestine. And patients come in with a number of very important kinds of symptoms, and symptoms that are often quite bothersome to them. They may have difficulty swallowing, they may have pain in their chest or their abdomen, they may see blood in their stool, they may have some change in their bowel habits, either constipation or diarrhea. So there are a number of reasons for which we're consulted.
At what point would a person then seek out your assistance?
Well, if you certainly if you have something that lasts for any period of time, or symptoms that are quite severe. So if you had pain that is new and you really don't have a good explanation for it, and it is quite severe, and the pain can be anywhere within your abdominal cavity. If you see blood, certainly in the stool, you'd want to seek out consultation immediately, and certainly any kind of pain that's associated with a fever, with nausea or vomiting, inability to eat or stay hydrated. So those are a number of conditions. Pain in the chest sometimes can be the intestinal tract, sometimes could be your heart. So again, you have to seek care to differentiate that.
Are there some common GI issues that can be screened for and actually prevented?
Yes, absolutely. Probably the most important condition of the intestinal tract that can be screened for are they call polyps, and these little bumps or growths in the colon, and they are considered to be the precursor to colon cancer. So they are the forerunner of colon cancer. So perhaps 98% of colon cancer really comes from these polyps, and the idea then is to screen the entire colon, the entire 5 or 6 feet of the lower bowel for polyps and for colon cancer. And actually by finding the polyps, because they grow silently, so you really don't even know they're there, by finding them, removing them at the time of a procedure called colonoscopy, then you actually can prevent the development of colon cancer. So it's really has this unique position, the unique ability to find a cancer before it even starts. And it's the colonoscopy procedure. There's a lot of fear behind it, basically because of the prep, and perhaps only 50% of people who are actually candidates to have the procedure done actually avail themselves and take advantage and actually have the procedure done. So unfortunately, we don't get quite the preventive benefit that's really, there's a high potential to prevent this. So I think it's basically a procedure that's done. It can be done as an outpatient. It takes perhaps a half an hour. So I tell patients, surely your life is worth a half an hour of your time. And you're sedated for it, and you're very comfortable for the procedure, and you don't have to drink some big gallon of yucky type of liquid. There are some suitable preparations. We use combinations of Gatorade or Propel or Powerade Zero, one of the sports drinks, and we have them mix a powdered laxative in it, and it's actually very palatable. I've taken it myself, so I can swear that it's not really all that bad.